Hi, everybody. I'm Brooke Walker with Active Family Chiropractic, and I am here to present to you today Bliss, a headache seminar. Migraines and headaches. So a headache is a pain or discomfort in the head, the scalp, or the neck, and in the U.S., more than 37 million people suffer from migraines. Some studies estimate that 13% of adults in the U.S. have migraines, and 2 to 3 million migraine sufferers are chronic. So this is a workshop discussing the causes of headaches and migraines and alternative methods to deal with this debilitating condition. The ache and headache does not come from the brain. Your brain can feel no sensation. What puts the ache in your headache are veins and arteries inside the brain and skull, membranes that wrap around the brain, and certain nerves in the head called cranial nerves. When these are pulled, stretched, compressed, irritated, inflamed, or infected, headaches can result. So typically, however, when you feel pain coming on in your head, one easily diagnoses this as a headache. And every headache is different and produces different symptoms, and telling them apart is sometimes very difficult. Headaches can be generally classified into two types, and those would be primary headaches and secondary headaches. One of the more common primary headaches are called migraines. Migraines are a disabling type of headache that are reoccurring and frequently occur only on one side of the head, usually result in other symptoms. Other primary headaches include cluster and tension headaches. Tension headaches are also very common headaches and are characterized by mild pressure. Cluster headaches are less common, usually bring on severe pains, described as stabbing pain behind one eye, and can be accompanied by redness and nasal congestion. The majority of people who experience headaches usually experience one of the primary headaches mentioned above. Secondary headaches are rare, more serious than primary headaches, and secondary headaches are associated with some other serious health problems. Some of these can be aneurysms, tumors, dysfunctions of the spinal fluid, or inflammatory diseases. Because secondary headaches are caused by underlying problems, they're much harder to treat. So it's important to know what type of headache you have so that you can seek the adequate support. A migraine or other primary headache can cause intense pulsing or throbbing sensations in one area of your head. Other symptoms can include some nausea, vomiting, light sensitivity, or sound sensitivity. Secondary headaches can be pointed out by neurological symptoms, so examine your symptoms carefully. Both types of headaches result in sudden and sometimes severe pain. So, as I said, migraine headaches are usually intense pounding or throbbing that becomes debilitating. It's localized in a certain area of the head and accompanied by pronounced sensitivity to light and sound. Some other symptoms can include nausea and vomiting. And when migraines are mild to moderate, they're usually described as being dull, deep, and steady. When severe migraines are throbbing or pulsating, and tend to be more common in women than in men. And every year, about 25 million people in the US experience migraine headaches. And about 75% of those happen to be women. So some types of migraines. There are hemiplegic migraines, which occur on one side of the body and can cause some temporary paralysis. Ophthalmologic, which usually occur behind the eye. They can even cause like a droopy eyelid and some vision problems. There are basilar artery migraines, which usually occur in adolescent and young women, and they result from a spasm to the basilar artery, which is a blood vessel at the base of the brain. There's benign exertional, which are triggered by physical exertion, sometimes running, bending down, lifting. Status migrainosus, rare, causes extremely severe type of migraine, and it can cause pain and nausea. And then there's headache-free migraines, which means that you have the visual impairments, the nausea, the vomiting, constipation, diarrhea, but there's not actually a headache that is associated with it. So tension headache usually cause minimal distraction, usually will not interfere too much with your daily routine. Some common staging of tension headaches include pain that begins in the back of the head and upper neck, some tightness or pressure. Sometimes intense pressure near the temples or the eyebrows occurs infrequently and without a pattern, and tension headaches are associated with stress, fatigue, and they can be precipitated by poor posture, eye strain, abnormalities of muscles or bones of the neck, misaligned teeth, or jaw bones. Massage and stress management are both alternative methods of easing tension headache pain in addition to getting regular chiropractic care. Cluster headaches are named cluster because they tend to occur daily for a period of a week or more, with long periods of time in between with no symptoms, and sometimes that can be months to even years. They will occur at the same time of the day. The cause is uncertain and may be due to release of histamine and serotonin in the brain. They tend to run in the family, so they're genetic, and they can be triggered by changes in sleep patterns or certain medications. Because they are so sporadic, cluster headaches are difficult to treat. Usually takes trial and error to find the right regimen that'll work for you. Headache pain can occur anywhere in the head, including behind the eye or ear, in one or both temples. And when you start to feel pain, it's important to access the location of the pain. It isn't rare to experience the pain of primary headaches on both sides of your head. However, more often than not, migraine pain is unilateral, felt only on one side. So secondary headaches are much more serious than primary ones and are due to underlying diseases or injury that need to be diagnosed and addressed. And some of the causes of secondary headaches may be potentially life-threatening and deadly. Therefore, early intervention is very crucial. So here's some categories of secondary headaches, and I want to go over those just briefly. Head and neck trauma, blood vessel problems in the head and neck, non-blood vessel problems of the brain, medications and drugs, infections, changes in the body's environment, and problems with the eye, ear, nose, throat, teeth, sinus, and neck, and some psychiatric disorders. So some head and neck traumas are some injuries to the head, edema, concussion, whiplash. Blood vessel problems could include strokes, cerebral aneurysms, and hemorrhaging. Non-blood vessel problems of the brain could be brain tumors, seizures, idiopathic intracranial hypertension. Infections could be like meningitis, encephalitis, HIV and AIDS, systemic infections of like pneumonia or influenza. And some changes in the body's environment can be high blood pressure, dehydration, hypothyroidism, and renal dialysis. Patient history and physical examination can provide the appropriate determination of secondary headaches, and it's important to seek a professional if new severe headaches arise. Proper evaluation can determine the headache cause and the proper care. Chiropractic care and headaches. Chiropractic isn't an aspirin. The point of chiropractic care is not to simply cure a problem after it starts, but even when you're feeling better, to help strengthen those muscles, support your spine, and prevent health issues from arising. So the main thing here is that it's more of a prevention type of thing. It's getting to a point where you can maintain your symptoms so that you can avoid them before the headaches ever start. So if you suffer from headaches, a chiropractic spinal checkup and massage are the two best things you can do. They're safe, gentle, drugless, have helped millions of sufferers over the years. Research actually shows that spinal manipulation, the primary form of care which is provided by a chiropractor, may be an effective option for tension headaches and other primary headaches. Spinal manipulation resulted in almost immediate improvement from those headaches that originate in the neck. Other studies found that spinal manipulative therapy is an effective treatment for tension headaches, and those that went under chiropractic treatment after 4 weeks experienced sustained therapeutic benefit, in contrast with those patients who received a commonly prescribed medication. So regular chiropractic care can really head the headaches off before they even begin, especially in cases of tension headaches and migraine sufferers. We've seen a fantastic amount of improvement with both of those in our practice. So chiropractic care can help prevent unnecessary tension or irritation in the neck and head. Care can determine whether the headache may be caused or aggravated by misaligned vertebrae in the spine, which is a condition known as subluxation, which can be creating undue nerve interference. So there isn't one method to help all types of headaches, and are each going by individual case-by-case basis. However, as headaches typically come from mechanical problems in the neck that increase muscle tension and irritate the delicate nerves that control blood flow into the head, improving the movement or alignment of the bones in the neck can relieve this pressure and alleviate the pain. So remember, chiropractic care will allow your body to, in effect, heal itself. Chiropractic spinal adjustments remove any nerve and spinal stress and allows your body to restore itself to a greater level of health and totality. The other thing I wanted to discuss is a few other methods that can additionally help relieve headaches. So trying heat therapy, alternating between cold compresses for relief of neck and head pain. Always remember that you should begin and end with the cold. Massage your neck to relieve tension, pain, and provide immediate relaxation. Laying in a dimly lit room, trying to avoid loud noises until you're feeling better. Things like lavender oil, it can be inhaled or applied topically. A few drops with a few cups of boiling water are recommended if you're inhaling the vapors. Peppermint oil can also be inhaled or applied topically. Headaches and migraine pain are often due to poor blood flow, and peppermint oil helps to open and close the vessels that promote flow. So peppermint home remedies also open up the sinuses so that more oxygen can get into the bloodstream. Flaxseed. Flaxseed can help provide headache relief because it's rich in omega-3s. Flaxseed can be used as a home remedy in several forms, including as an oil and ground or whole seeds. Buckwheat. Buckwheat's usefulness as a home remedy for headaches and migraine pain comes from a flavonoid known as rutin. And flavonoids are phytochemicals which are found in plants and have been shown to contain antioxidant properties, which counteract damage to cells. So in addition, researchers in Taiwan have demonstrated the effects of flavonoids on inflammation, which is a common cause of headaches. Prevention of headaches. So as far as prevention goes, posture is a big one. So sitting up straight, being conscious of your posture. Don't forget to relax regularly during the day. Drinking a warm cup of tea, get up from your desk, take a moment to breathe. Make sure that you're getting plenty of sleep. Average amount of sleep that people should be getting, and this varies from person to person, but it is 7 to 8 hours. If you're not getting that much, chiropractic care can help you with that additionally. Eating foods prepared with MSG can result in headaches. Some of these are soy sauce, meat tenderizers, and a variety of packaged foods that contain this chemical as flavor enhancers. And foods that are high in amino acid tyramine should also be avoided. These would be ripened cheeses like cheddars and bries and even chocolate. Avoid exposure to poisons. And obviously, none of us think that we're exposed to that many poisons, but a lot of common household items include things that can add to headaches, like insecticides, batteries and pottery and things like that. So the other thing to track them is to keep a headache diary to help determine points during the day your headache comes on and to pinpoint your headache triggers. I think that this can be particularly helpful for women. Since 75% of more women get them, I would attribute some of this probably to hormonal things. And so tracking whether or not they come during different times of the day, during the month, is useful to see what helps bring them on. Last thing, get adjusted. We have so many clients who come into our office on a regular basis who are headache sufferers who get an enormous amount of relief. I'm not saying you won't ever have another headache again if you were to come in our office or be seen by a chiropractor, but it will definitely lessen them and improve your health. So I hope you all enjoyed this presentation, and I hope you all have a wonderful day.